All right, we'll show you a couple things you can do today to work on that hip internal external rotation. A little non-traditional way to do it. Everything's a little non-traditional. Forgot to post from the workout studio, so we're doing it outside today. But what we're going to look at is a different way to work on some hip rotation. It's very subtle and it's going to be hard to see in the video, but once you try it, you'll get the gist. So you'll just need a yoga block, medicine ball, something like that, and you will be in a half kneel position, and we're going to be working on the rotation of the down knee. So you're going to hold the ball or your yoga block or something out in front of you. You're going to squeeze it to engage that core. You're going to lock in the upper half of the torso, and then you're going to rotate at the hip. And again, it's going to be very subtle. You'll have to look close. We'll go over it in a couple of different angles just so you can see it. But ball's out, squeezing the ball, and what we're going to do is I'm going to actually rotate my hips. Upper torso doesn't move. When you try this, your brain is going to tell you that you want to rotate here. We're not rotating up top. We're nice and stable at the top. We're only rotating in the lower half. So we're here, and then what I'm going to do is I'm opening that hip up towards the camera, and then I'm coming back and I'm closing it down towards the midline of my body. So it's very subtle. You're opening, really working on the end ranges of that hip internal and external rotation right there. Squeezing the ball, engaging the core as you do it. Again, it's a very minor movement, but once you try this, you will feel that hip trying to rotate right here, right up into that pelvis. So that's where we're working. Again, a little different angle so you can see it from this side. Again, working lower half only. So we're here, and again, automatically brain wants to rotate, wants to move that upper half. We try not to do that. Lock that guy in, and then we're going to rotate internal, and then we're going to rotate the hip out. So hopefully you can see my hip trying to rotate towards my midline and then rotating out. Again, if you try it, you have to try a few repetitions, really work. When you feel like you've kind of gotten to the end range of that movement, really try to squeeze that ball, tighten the core, and see if you can get a little bit more movement out of that hip. It's a little different type of movement. And hopefully it will help open you up a little bit, maybe a little bit different feeling than you're used to. Try it out.